Good Friday morning. It is September 24th. We are live inside the Dolph Simons Jr. Family Broadcast Studio. Welcome into the morning medical update. As Pfizer announces its vaccine is safe and effective in children ages 5 to 11, the question now is, when will it be FDA approved? We're going to hear from Dr. Amal Purandaway. He's infectious disease physician at Children's Mercy on what parents need to know. But first, Dr. Dana Hawkinson joins us with our numbers. How did we do overnight? Good morning to you.
Yeah, overall the numbers are better. 32 active infections. We have kind of seen this where we see a dip in our active infections on a Friday, and then it usually comes back up. But it's good to know that it is 32 active infections with 11 patients in the ICU and 9 on the ventilator. 5 of those 32 patients are vaccinated. We should say that in the ICU, none of those 11 patients are fully vaccinated. Also, there are 38 additional patients in recovery, so a total of 70 patients right now.
And you said everybody in ICU is unvaccinated?
Correct.
Is that what I heard?
And
okay.
Everybody on the ventilator is unvaccinated.
Okay. Do we have any reporter questions on this Friday morning? We do not. So we're going to get to your community questions here and some follow-up questions here in just a moment. But if you're just joining us today, we have Dr. Amal Purandaway. He's infectious disease physician over at Children's Mercy. So good morning, and we're really glad you're here with us today.
Good morning. Mm-hmm.
We always have lots of questions for you folks. So just glad you're here on this Friday, sending us into the weekend. So first things first, tell us the Children's Mercy numbers today.
So this morning we have about 14, at least as of this morning, there's 14 hospitalized patients that tested positive. And then I'd say since kind of going overall, since March, we've had about roughly 8,000, I think, that have tested positive. So I'd say from prior in the week, it's gone down a little bit, but we're still at, 14 is a lot higher than what we were seeing just a few weeks ago.
We've been saying Delta is different, so we're seeing a difference in numbers. They're not going down the way we want. So you, of course, know on Monday that Pfizer said that their COVID-19 vaccine created an immune response in 5 to 11-year-olds. So in other words, they're saying that it's safe. Now it's up for FDA approval. That's the next phase. Children's Mercy, they were involved with that trial. Is that correct?
Correct. So at Children's Mercy, they've worked at both the 5 to 11-year-olds, as well as even the kind of the dose finding for the younger ages, so the 6 months and up as well.
So the question we get asked daily, and I have the same question too, because I've got little ones as well. When can we expect this to roll out?
So at least for the 5 to 11-year-olds, I'd say now that you have the response from the trials, it'd probably be in the next couple of months, I'd say, because it will have to go to the FDA, and then the FDA will look through the data that the company has, and then make sure that it is truly safe and effective to use in children.
So Dr. Purandaway, I think the hope was that this was going to be ready to roll out in time for school to start. So how, I mean, we say 2 months, we're hoping it could be a little sooner. Every week, I think, matters when you have all these kids in school. How do you think that 2-month window there of when this will be ready to be in our kids' arms, what kind of effect do you think that's going to have as we head into the winter season, especially?
So, I mean, I hope that it would we're able to get this started prior to our winter season, because even though right now it's odd, we're seeing RSV and some of our respiratory bugs in the summer, which we normally don't. I think we'll still be seeing a lot of our respiratory bugs in the winter time as well. So, I'm hoping that all this data gets to the FDA and that they're able to kind of go through it in a quick way, because what they should be doing is comparing it to the adult data that's already out there. And so it should be hopefully relatively quick. And from I think, standpoint for the children, I think it'll be helpful every little bit that we can get every time. The sooner we can get it, the better.
Well, and it's not, we've always said, it's not just having the vaccine available, it's actually getting the vaccine into your body. So children now account for 1 in 5 cases. That's a lot to hear that. Why is it so important that kids get the vaccine and parents understand that?
I think it's so important because, we're seeing we're seeing different patterns with, especially with Delta kind of taking over as the predominant strain. We're now seeing a lot of these things affecting children. And it's not just acute COVID. We're seeing the kids with acute COVID being in the hospital, but we're also seeing MISC, which we don't really see, yes, there is kind of multi-system inflammatory syndrome in adults, but really this is something that affects kids. So 4 to 6 weeks after being affected by COVID or being exposed to COVID, they're having this vast inflammatory response that's happening. So that has to be looked at. And then we also have a lot of teenagers and adolescents that are having long COVID syndromes or symptoms that need to be looked at. So getting that extra protection as soon as we can for children is going to be important, and making sure families understand how important it is to prevent these things that previously were not thought to be affecting children as much.
Gosh, it's like almost anymore for a parent. I know me personally, the long haul symptoms and not knowing what's down the road from the effects of COVID almost scare you more than any of it.
Exactly. I think that's the biggest thing. We often hear that parents are afraid about long-term symptoms about the vaccine. I think that we know what has been in the vaccine, and these vaccines are really simple vaccines if you know how vaccines actually are made and how they function and work. What we really need to be worried about is the long-term symptoms of COVID, because we don't know. I mean, is there something that you're exposed to COVID and it might affect you now, but could it affect you in a few years, 5 years, 10 years down the road? All the vaccine is doing is priming your body for being protected for it, but there's nothing that lingers in your body from the vaccine itself.
But you made a good point, which leads into my next question, which is, if you know how it's made, if you know how it works, and a lot of us parents don't know any of that. Yeah. So what are some of the concerns and questions you're getting from parents? I'm sure you get asked all the time about just how safe it is.
Yeah, I'd say for the vaccines, a lot of parents, a big question is really just they don't know, or they think that the product was rushed. And I think, now we have a lot of information. We have, over 4 million adults in the U.S. that have been vaccinated, and over 6 million, I'd say, worldwide that have been vaccinated. And so we see over the past year and a half how effective and the benefit of these vaccines. We also see that there is a kind of a overall safety profile for it. So when we look at the number of kids or the number of adults that have adverse events or adverse reactions, they're extremely, extremely low. And a lot of the things that we compare against are going to be significantly higher when you are exposed to COVID itself. And so I'd say that unknown part really, now we have a lot of things that are out there to compare to. And then even things, so in the teenagers, parents were worried about the myocarditis aspect of things. That was linked. That signal is still lower than if you're exposed to actual COVID. And so overall, this is still a safer thing to do, and it prevents you from a lot of the symptoms. It also helps cut down on your ability to spread it to others as compared to being exposed with COVID.
Dr. Perron-the-Way, did you think this would be a little bit easier? Did you think that, great, we've had vaccines around forever. We were born into a world with vaccines, and that when this one came out, everyone would get the vaccine and we could move forward? Or did you anticipate having to teach and get everyone caught up and have to have this much conversation and help people understand more about a vaccine?
I would say that was my hope, but I think being an infectious diseases doctor, I think you look a lot at what has been done in the past and kind of comparing to how people have dealt with pandemics in the past as well as with vaccination. And I think so it's not surprising, I'd say, that the response that we have, but I think that's our job in the medical community, is to really take the time and teach and educate and be understanding, because it is scary. I mean, you don't understand. If you really don't know what's going on, it's hard to put into words, and it's hard to really know what is going to be affecting you, and why would we be giving these medications or these vaccines, and so I think it's really important for us to take that time and kind of explain why we know these are safe and why we know that they'll be beneficial.
Well, and I think there's really no wrong question when it comes to this. If someone has a question, let's get it answered. I bet your phone blows up all the time with text messages from people, right?
Yes. So I get questions, comments, everything from, all different types of people. So, friends, family, other doctors. So, because I think that there is a lot that we have to know about. And, this really has been something that kind of is I think the miracle, or like kind of what we are amazed about for medicine, is how this kind of was unfolding in real time. And so the way that we could experience it in real time has been kind of great. So we have to kind of build off what we know in the past, but then also use that information to what are these new technologies, what are these new vaccines, things that we can use for our patients.
What can you tell us about the dosing? Is it the same amount of dosing? And then I understand it's just a less dose of the same vaccine.
Correct. So this is the same vaccine overall from Pfizer, but what they usually do is they kind of do a ramp up, ramp down model in deciding the dosing. And so it was decided in the 5 to 11-year-olds that they would go with a third of the dose. So instead of the 30 micrograms, they would go to 10. And so that was thought to be a little bit safer and more, but still show the same kind of effectivity or robustness of response. And then in the younger children, they're looking at going at an even lower dose of that, so potentially going to a tenth of the dose. And so at least at this time, we'd be looking at a point. So going from 30 to 10 for the 5 to 11-year-olds.
So once this is approved for 5 to 11-year-olds, that's going to, of course, leave out the 4 and under. Mm-hmm. A lot of those kiddos still out there. So what advice do you have for parents moving forward? It just seems like there's always that one little group left out until we can get everybody vaccinated. Is it business as usual for those families?
I would say so. I'd say that I would still keep with the precautions, because I think that it's really important until we get the overall spread of the SARS-CoV-2 virus and we can get COVID infections kind of under control, doing those precautions are going to still be the best thing. So still, when you're out and about, masking up, making sure that you're washing your hands, distancing as best as you can, because just because you've gotten the vaccine doesn't necessarily mean that you're kind of out of the blue from still spreading or transmitting the virus. So to protect those younger children and to make sure that your family is still protected, I would say it's important to do the distancing as well as masking and hand washing. Somebody
said this on the show the other day. This pandemic is not over until everyone is vaccinated. So we got to get everybody vaccinated. So good advice to just keep on pushing through. We're coming for you. Okay, so the question is, when the vaccine is available, will parents take their kids to actually get it? A Kaiser Family Foundation study looked at that. And Dr. Perron, take a look at this. I just want to know what you think. So it found that only 26% of parents polled will take their children to be vaccinated right away. 4 in 10 parents said that they will wait and see how it's working before they get their kid vaccinated. 9% will only vaccinate their children if it's required. And 25% said they will not get their children vaccinated. Your thoughts on that?
So, in a way, it's kind of surprising, because you would think that with everything going on, we would expect a lot of families to, jump to get the vaccine. But on the other hand, it's actually not that surprising when we look at our overall rates of vaccination, even for vaccines that we've had, for years and years and years. So I think that little bit of initial hesitancy makes sense for people to have. I think, again, comparing to what we've seen in adolescents and in adults, I would, if this was my child, I would go right away to get them vaccinated. The second that I have a 1-year-old, the second that it's available for him, I'm going to get him vaccinated. So I think it's just taking time as medical professionals to explain the safety profiles and looking at the most recent data. And we have really good information in pediatrics now from the trial. So I think being able to pass that on to families when it's publicly available is going to be really helpful. You
said you have a 1-year-old?
Yep.
You had a baby during a pandemic?
I did.
What was that like?
It was interesting. It was, it took a while to get him acclimated to other kids and to, people, and then trying to figure out childcare and all those other things. So I definitely feel for everyone out there. So.
Yeah, gosh, that stood out. Yeah, that's not easy. But I guess if your dad's an infectious disease doctor, you probably do things pretty right.
I would hope so. Maybe I might be a little bit more like, just rub some dirt on it, you're okay.
Right. I have a feeling, Dr. Hawkins, that's probably the dad you were and probably still are, right?
Rub some dirt on it, yeah.
Make it go away. It'll be fine.
Yeah. Just wash your hands afterward.
Absolutely.
exactly.
That's the new thing. Who knew that washing your hands would be a new thing, huh?
Yeah.
Okay, so we're going to get to some community questions and some of your follow-up questions. But I wanted to ask, because Isaac wrote in while you were talking about this, Doctor, just kind of what is the overall sentiment in the KC metro area regarding willingness to vaccinate kids? We saw that graph, which you said was surprisingly low, but just in general, do you feel it's the same as the adults? Just what's your insight on what you're hearing among your peers?
So I would say that it is, I'd say it's actually a little bit different than that graph, because I think that hearing it from families, at least all the families that we come across at Children's Mercy, a lot of them seem interested, especially I'd say families that have other medical conditions. They are definitely, pushing to get vaccinated for everyone. And then it's interesting, actually, some of the children and the teenagers are actually, like early adolescents, are really interested in getting vaccinated, because I think that they're probably hearing, and it's always amazes me how receptive and kind of intuitive children are. And to kind of hear that children are thinking about that as well has been really interesting.
I know my daughter actually is in the studio right now back with the guys, and I want to say hi to Anthony and Logan. Hello, guys. Oh, there she is. Okay. And Dr. Perr on the way, she walked in and he was like, kids are really perceptive when it comes to the things. They're better at it sometimes than the adults. So, I'm going to kind of put her on the spot and ask her about her plans for the vaccine.
Yeah. I mean, it always amazes me that you see kids, and the kids wear masks better than adults do.
Yeah, sometimes I've had to tell my daughter, we're in the car, we're safe, you can take it off. Yeah. She's like, nah, I'm good. Yeah. So it's kind of a way of life for them, kind of that badge of honor, and being responsible and showing their friends how it's done. Okay, so I want to ask you this. This is our first follow-up question, and I think you touched on this as well, but an NPR model suggested no winter surge this year as children continue to get vaccinated in the next couple of months. What are your thoughts? I mean, you said it's going to be a couple months before the little ones are vaccinated, so that might not even come into effect. What are your thoughts?
So I'd say it's hard to say. I'd say if we look at kind of what our overall models are and the spread of how the SARS-CoV-2 SARS-CoV-2 virus has been spreading, it's possible we won't have a winter surge. But that being said, I wouldn't be surprised, because again, as long as we have the virus circulating, there's a chance for new variants, there's a chance for kind of changes in how the spread occurs. So I'd say the one thing that we've learned about this virus is that you can't count it out for anything.
Jane wants to know, have any children died of COVID-19 in the U.S.? I think we reported yesterday that the first Kansas teen died. That was announced just yesterday. But I see people posting that there is no risk of death in children. Simply not true?
Simply not true. So there have been children that have died. And so in Missouri, there were, I think, there's been 6 children that have passed away from COVID-related illness, and then in Kansas, we just had the first one. And across the country, so in Louisiana and Florida and Texas, there have definitely been deaths related to COVID. And you can't really, say this is that they weren't necessarily healthy. Yes, comorbidities play a role in the severity of disease, but there have been previously healthy or relatively healthy children that had severe disease and passed away. And I mean, I think that's a big factor too, that, we often look at morbidity as a big factor at all this, and especially in adults, we're looking at the amount of people that died, but we're not looking at we look at mortality, but we don't look at morbidity. We don't look at the people that are affected. I mean, how many people are being placed on ventilators? How many people are going to have to go into rehab or go through physical therapy or occupational therapy, or just have their life completely turned upside down due to severe COVID symptoms? And I mean, in kids, we're seeing this, kids that are having to be, were once great athletes and now are going to have to sit out maybe 6 months or, a whole season due to being affected by severe COVID.
Yes, many, many other lasting effects. So, Dr. Hawkinson, jump in here with us. Is there any verified data proving that vaccination decreases transmissibility?
Initially there was, and then Delta came around. There was that good study out of Singapore showing that viral loads, although the same in the people that are vaccinated versus unvaccinated, those viral loads tend to drop a lot quicker in the vaccinated people. So you are shedding those high amounts of virus much shorter than those unvaccinated people. There was a morbidity and mortality weekly report, I believe, out of looking at Kentucky that also showed that there is somewhat reduced transmission in the real world experience. We don't have necessarily the laboratory data looking at the true viral loads from beginning to end, but although we don't know that it as significant as the previous variants, with Delta, we still believe that there still is a reduced transmission for those reasons that I stated, and more information is coming out on a daily basis. So.
Dr. Poor, on the way, getting kids to mask up is, I think, a big win for any parent and teacher, that's for sure. What's the best type of mask for young kids?
So I'd say the best mask is one that fits well. So something that's comfortable, something that they would not mind wearing. The regular cloth mask is still just fine for children to wear. It's the biggest thing is making sure it covers the nose, covers the mouth, and it's fits snugly enough. You don't need to have like a special N95 or anything along those lines, because as long as everyone's masked up and we can get more people vaccinated, that's going to cut down on the spread.
We went mask shopping the other day. I don't know how much money I blew through, because that's the one item you can't return if it doesn't fit. So we were going through and cutting them open, trying them on. No, those hurt my ears. No, this is too big. So I was like, all right. I said, tell me if there's anything about it you don't like or is uncomfortable, because I need you to wear it all day. I'm asking you to wear it all day. At least I can make sure you have one that fits really, really well. Yeah. So we finally found something. Nice. Okay, so what role do kid vaccinations rates play in getting through this pandemic quicker? Again, we've touched on that a little bit, but just kind of dive into that.
So I'd say the sooner that we would be able to get kids vaccinated, that will help overall, because while, on the most part, it seems that kids get affected by, other family members being, having the virus, the transmissibility is still there from kids as well. And so, and we've seen this kind of across the board, that kids are able to transmit. So getting them vaccinated, preventing them from having severe disease, but also cutting down on that rate of transmissibility will help.
Dr. Hawkinson, Shannon has a question about symptoms, because we talk a lot about those initial symptoms being, respiratory. She said that she has heard a lot of people that are testing positive for COVID and only are experiencing GI symptoms. Is it possible to just not have any upper respiratory symptoms and be COVID positive? I guess if you're having GI problems, you go get tested and don't take chances.
Yeah, absolutely. That seems to be less, but we know it can happen. We know that there are the receptors for the virus in your GI tract. I would still expect some sort of associated respiratory symptoms, whether it's just a runny nose or sniffles or a scratchy throat. That will happen less when you're just having the GI symptoms, but it is certainly plausible. We've heard these stories really since the early parts of the pandemic as well, while we were still trying to get our own information from the United States experience in Europe and all that. So we do understand that can happen. It's probably less likely. We know that there are other things, other viruses out there and foodborne illness and stuff that can cause those symptoms as well. But just be on the lookout for those other respiratory symptoms or systemic symptoms like aches along with the GI. But if there really is any question, or that you have been exposed, it is certainly reasonable to go get tested. And I also would just like to make a comment on the last question about the verified real experience of reduced transmission. Really, the best real world experience we have is that in the household contact articles, and there are a few of them, showing that there is significant reduction in attack rates in those household contacts who are fully vaccinated with those people that are ineligible for vaccination, compared to those households that don't have anybody vaccinated. So you do have a reduction in transmission in those close settings in the household as well.
Jill wants to know, when will the hospital, or do we offer the third now FDA and CDC approved Pfizer booster dose for those over 65? Can they get that?
Yeah, I think, first of all, we were waiting for the full approval. And then also, we were waiting for KDHE to okay it as well. They did put out some information, and this was earlier in the week. Now things have changed since last night, So we really should be able to start giving that nearly immediately. We just need to make sure from a regulatory standpoint that we are able to do that, and I expect us to be able to do it within the next 24 hours or even Monday as well. So that being said, we just need to make sure that, again, from a regulatory standpoint, we can do that. We do have plenty of doses, and we are also building the IT portion of that as well. So most people who have gotten their vaccines here, and again, remember, this is just for Pfizer right now, should imminently be able to come get their third dosing.
All right. So Lindsay wants to know, since we have had the vaccine out for 9 months, what is the data showing for immunity of those who have been vaccinated for 9 months, knowing that we've had some breakthrough infections? But
no, it's still very good. I think the underlying message for everybody to remember, because now with talk of boosters, everybody is concerned, the underlying message and the main consistent message continues to be that these vaccines are extremely effective. They continue to be extremely effective. Even in all the morbidity and mortality weekly reports that came out last week looking at dosing and vaccine effectiveness and age, one age versus another, they all continue to show that the effectiveness of the vaccine in preventing hospitalization, severe disease, and death continues to be high, even 6 months out. I think it was yesterday that the Moderna group published some of their analysis relating to their original trial people, and even months out from that, the Moderna vaccine continues to provide good protection against going to the hospital, going to the ICU, and of course dying. So if you are fully vaccinated, just take into this to heart. You are still really well protected. There is no rush to go out and get that third dosing right now. Let everything settle. Let those systems and protocols be in place, and then you can go get it. But overall, you are still greatly protected from that severe illness.
Dr. Perrunaway, Scott wants to know, what recommendations would you have as a pediatric infectious disease doctor for schools about masking at each level of schooling?
So I think that I would recommend that all age groups still mask up. I know that a lot of this is very much dependent on each school district and how they decide to do the masking and their different protocols. But even in the teenage groups that where you're seeing that sometimes there's some mask leniency, I'd say as long as there are children that are not vaccinated in that group, I would still recommend masking up at all stages.
Karen wants to know, my adult daughter has type 1 diabetes. It is very well controlled, but I'm curious if she should get the booster shot. She also works in a preschool. Yeah. That's for either of you.
I think that it's definitely something to consider, as Dr. Hawkins mentioned. The immunity that you get from the standard vaccination 2-series set is going to be pretty robust. You're going to have the ability to still have great immunity, and it'll prevent serious disease and hospitalization. But it is definitely something to consider, as diabetes kind of is one of the things that you can be accounted for.
Yeah, and I think this goes to one of the last points of, who is okay to get that additional booster dosing based on the CDC recommendations or what Dr. Walensky had talked about last night. And so this is very vague. Again, they did say that people who are 18 to 64 who are at increased risk of COVID-19 exposure, I would think if you're working in a child care facility, you would be at increased risk of exposure because of the occupational institutional setting, may receive a booster vaccine. So may is a very vague word. It does leave a lot of room for interpretation. Obviously, with the diabetes, that would maybe put her in a higher risk category as well. So take that for what it is. She would probably be eligible. They also say based on the benefits and risk. Well, again, the risks of these vaccines are extremely, extremely minimal. The benefits are great, however. So in this case, I think if it were my child or if I was this person, it would certainly be reasonable to go get that.
Can someone have a positive COVID test beyond the active disease period? And if so, how long past that period?
So don't know. Let's see. Can someone have a positive? Oh, yeah, you can test positive for COVID for weeks.
Yeah.
We do understand
Okay.
this, especially with the PCR testing. With the antigen testing, it is less likely because we don't feel that your viral load is as high for as long. But with the PCR testing, it is so sensitive. If you are taking those upper respiratory tract samples, you can test positive for weeks. This has been something that has been known since really the beginning of the pandemic. So we don't recommend for the general population retesting after you've already tested positive.
So that's why you wait that 10 days that you've always recommended.
Correct.
Got it. You're safe and clear to come back to work and school. Okay, so if I'm, so that's that one. Okay, last question for our follow-up. If I'm vaccinated, can I still pick up the virus and pass it along to my unvaccinated children?
Yes, you can. And so that's, again, why we recommend masking and distancing in social settings as much as you can. There's always that possibility of passing it on to your children because, I always think about it. It takes time for your body, once you're re-exposed to a virus, your body still has to kind of kick in that immune response. So it'll still be a day or so before your body gets a chance to get that upper hand. So the possibility of passing it on is still there.
I want to give you a chance to speak to one of our viewers, Megan. She says, why are we okay with giving a vaccine to an age group that is not affected? I want to hear from both of you about that. Who wants to go?
So I can start. I will say we definitely are seeing kids, so from all ranges. We've had neonates, so infants that have been transferred into our NICU due to exposure and having symptoms, all the way up to 22, 25-year-olds that have, that were born with illnesses that we still see at the pediatric hospital. So in the pediatric range, we are seeing it, COVID in the entire range. So I can't say that we're not seeing it,
Dr. Hawkinson, can you add to that?
Yeah, I would just like to clarify, are we talking about vaccination for children? Is that exactly what the question is?
Yeah, why are we okay with giving a vaccine to an age group that is not affected? So I'm, without further clarification through that, I'm assuming we're
talking about children. Okay,
Correct.
I just want to clarify that. So that statement or that question would not be informed by science. Just so we've heard our guest talk, we know that children are affected, can be infected, and can have significant outcomes, or either acutely or the long term. Initially during the pandemic, but now we're going back 16, 18 months, we thought children really weren't infected, which is really the reverse of every other illness that we've ever seen as far as respiratory and GI illnesses in children and spreading through schools and daycare and whatnot. But now we do know that they are infected, they can be affected, and so that is an old way of thinking that would not be supported by the current data. And in addition, we know that children can spread and replicate the virus at the same levels as adults. So it is important to vaccinate everybody.
All right, and Megan, I appreciate your question. So if I misunderstood that or we didn't answer it the way you wanted, please feel free to let me know. So here's a question. You touched on it, Doctor, but do we think that the kids' vaccine will be ready for Thanksgiving and Christmas gatherings? Are we going to be giving it as a gift this year?
Yeah, I think that would be my hope. I think that there's enough data out there, and I think that, knowing the usual timeline for the FDA, that's something that is definitely reasonable to happen. So I would say, you can have, a side of turkey and get the vaccine at the same time.
Yeah. That sounds good. I like that. All right, keep a good thought. Okay, so Nancy, you're going to get the last question. If a person is taking a chemo treatment, will the chemo treatment cancel out the vaccine that they've taken, Dr. Hawk?
Yeah, I think number one, it depends on what chemo treatment you are on, what stage within that chemo treatment or what time frame. It's best to work with your medical team at that point. Our chemo treatment physicians and our oncologists and other people who are giving chemo really have a good handle on the best timing to give things like vaccination. So there is certainly that possibility that if you are on chemo and you are knocking out your immune cells, that you may not have a good response. Even in a lot of these cases where we think that might be true, we are still giving the vaccine because we know that the benefits far outweigh any risk. But a lot of things and what we have seen in people that are going through chemo, the physicians, the medical team really try to time the vaccination in that period where you think you have less of that chemo effect.
All right. So, so before we get to our final thoughts today, we do want to share some new numbers with you. We get asked about the cost of treating someone with COVID quite a bit. So take a look at this. A Kaiser Family Foundation study found that the preventable cost of treating unvaccinated patients in hospitals totaled $3.7 billion in August. That is almost twice the estimates for June and July combined. The total preventable cost for those 3 months now stands at an estimated $5.7 billion. So keep in mind, many, if not most of these, are preventable costs. We know there's some reasons that people do not get vaccinated for some isolated reasons, but these patients were not vaccinated. The study thought that on average, each COVID hospitalization results in roughly $20,000 in hospital costs. So just one more thing to keep in mind as you make that decision whether or not to get your vaccine. I want to get to our final thoughts. And Dr. Perrendaway, great to have you here. Please come back and join us.
Thank you.
Yeah, I put you to work today answering a lot of our parent questions because they just keep coming at us. So what do you want us to know as we head out into the weekend today?
Yeah, no, it's thanks for having me. It's great to be here and answer the questions, because I think that, again, going back to the more that we can talk with our families, more that we can explain why we need to do this, is going to be helpful. I'd say at this time, it's important to keep wearing your mask, keep distancing as best as you can, and if you're able to get vaccinated, to please do so.
All right, love it. Dr. Hawkinson, final thoughts on this Friday?
Yeah, it's going to be nice weather. We know art fairs going on, so it'll be good. People can be outside, try to social distance if you can, but enjoy. Support the artists, local, and the ones that come in as well. And but most importantly, if you're not doing anything else, please go out and get vaccinated.
All right, so we've got a final thought. So we've been talking about kids today. I had to bring my kiddo in today. They're always off on Fridays. I said, get on over here. You can have a final thought or two, all right? You can take your mask down. Since we live together, you can get close to me. So I have to ask you a couple of, we talk COVID on this show, so I have to ask you COVID questions, okay? It's not about your favorite color, favorite food, okay? So tell me, what has it been like at school, masking? What are your thoughts about this pandemic?
Hard. And kind of hurting because hurts my ears because I have to wear it mostly the day, only like lunch and snack and stuff. I take it off, but everything else I have to leave it on.
And you're pretty good at doing that? You don't mind doing it? Setting a good example. How are your friends how are your friends handling the pandemic at school and stuff?
Good.
Pretty good? All right, so what about this vaccine? When we went to see Dr. Lauer a few weeks ago, he asked you if you were going to get the vaccine. What are your thoughts about getting it?
I want to get it, but I'm also kind of scared.
What are you scared about?
It's hurting.
Well, it'll hurt a little bit, yeah.
But I know I have to get it.
You do? All right, so you're going to get it? We'll go do it? All right, you're in. Sounds good. All right, you can move back in now.
Well,
I love it.
Our guest has been really good, but you really classed up the show.
Yeah. Right. I mean, I try.
Thank you. Very good.
She's got to
Thank you
come
very
hold
much.
me up every now and then. So she does that for me. Well, pretty much every day. But all right. So thank you to all three of our guests. And thanks to, of course, our viewers. We love having you with us every single day. So we hope you enjoy your weekend. And we're going to be back with a common question on Monday. Is it a cough? It's shortness of breath, fatigue, sore throat. So is it COVID or is it fall allergies? We're going to sort through all that on Monday. And yes, Dr. Stites is back next week. I don't know when. I'll track him down and find out when he's going to come make his appearance. So have a fantastic weekend. Stay safe.
Go Chiefs.
Go Chiefs. And we'll see you at 8 o'clock on Monday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.